Everyone, how are you? Welcome to another question and answer session. This is the physiology portion of MRCS. A 24 years old man involved in road traffic accident. His right leg is trapped for 6 hours. This time is very important. His leg is trapped for 6 hours. And while he is moved on examination, his foot is intense and dorsal spadius pulse is only weakly felt. Which of the following biochemical abnormalities listed below is most likely present? The options are alkalosis, hypercalcemia, hypocalcemia, hyperkalemia, and hyponatremia. So we have to find out one of the answering option which will be answer of the question. First of all, here we can see a 24 years old man undergone road traffic accident and his foot was trapped for 6 hours. So his foot is trapped for 6 hours, such as this type of foot is trapped for 6 hours. That means there is necrosis or there is death of the muscle tissue occurs. And here one important point that the cell actually the cell, any type of the cell, he is rich in potassium, is rich in the potassium, and extracellular matrix they are rich in the sodium. So this point is very important, that the cell is nothing but bag of potassium. That means heavy amount of the potassium they are present within the cell. It is about 145 to 150 millimole, which is more inside the cell, and outside the cell it is 3 to 4 or 5. So it is very high concentration. On the other hand, in the extracellular matrix there is a high concentration of the sodium, which is 135 to 145, and the sodium and potassium they are like enemy. That means when there is sodium more, then this area potassium less. When there is sodium less, in this area potassium more. In this condition, the cell is a high level of the potassium. So in case of trapped for 6 hours, what occurs at this scenario? The patient develop compartment syndrome. That means there is a high level or pressure within the compartment of the foot, they are increased, and for this condition muscle is death and necrosis occur. So there is a death of the muscle, and muscle is a one type of the cell. Here this is the muscle, or this is muscle, and this muscle actually they are bag of potassium because they are the cells. So the muscle, which is a cell, it is a bag of potassium. So when muscle death occur, then huge amount of potassium enters into the blood. So huge amount of the potassium it enters in the blood, and it also highly likely to there will be damage of the renal impairment. There will be chance of development of the renal impairment, which is the acute tubular necrosis. Acute tubular necrosis occurs due to the myoglobin from the muscle, and result of which serum potassium level will be increased. So any type of the cell death, not only trapping in the road traffic accident, any type of event which causes destruction of the cell, this will increase the potassium level. Such as the in case of burn, what happened? There is the destruction of the cell and release of the potassium. Such as operation also. In operation, what we do? We cut the skin, we cut the other structure. So we cut the skin, we damage the cell. When we cut the other structure, other layer, at the same time we damage the cell, and there is the release of the high level of the potassium, and blood potassium will increase. Here the scenario within the cell, there we can see it is the high level of the potassium within the cell, and outside there is less amount of the potassium. Here we can see the blood potassium, it is about 4 milliequivalent per liter or millimole per liter. On the other hand, intracellularly, potassium is 150 milliequivalent per liter. That means on 50 divide 5, that means the 30 times more potassium in the cell relative to the extracellular matrix or blood. So what will happen? What will increase? It will increase the potassium level in the blood, because in case of the when muscle trapped more than 6 hours, in this condition muscle will be damaged, necrosis and death of the muscle, and finally muscle is a cell. So when cell destruction occurs, their potassium level will be